Hi, speech class. I'm Kimberly Henderson. I'm a second-year midwifery student at Southwest Tech, and I'm a longtime doula and childbirth advocate, and I have had my own experiences that have made me want to become a midwife. And I don't know if you know this or not, but our most current data from the CDC says that women are twice as likely now to die in childbirth as they were 20 years ago. I don't know about you, but this is shocking to me. We are a country that pays triple the amount of most developing countries for our health care, and yet we have abysmal outcomes, especially for childbirth. There are a lot of reasons for this, some of which are the most recent cuts to Medicaid and Medicare, and cuts to funding for little local rural hospitals or hospitals in urban areas too. The Big Beautiful Bill is just one example of the recent healthcare cuts in recent decades. That's made it really hard for a lot of people to get the healthcare that they need. Another reason is we have maternal healthcare deserts, just like a food desert. A maternal healthcare desert is one in which, according to the March of Dimes, there is no OB, there is no hospital with a delivery suite, there is no birth center. So that's a real problem, as you might imagine, having an entire counties, and 30% of counties in America are maternal healthcare deserts, means that a lot of people are either getting little care or no care, or just scattered care from time to time, because a lot of people are having a harder time traveling too, with increased prices of everything and gas prices going up and everything. So many people are now opting out of doing all the prenatal care that is recommended, or maybe not any at all. So that is a problem. Another thing we see is that there is a lot of racism in the healthcare system. It has been handed down to us, unfortunately, in this country. Modern gynecology was created by a doctor named Dr. Sims, who did his experiments on Black enslaved women to find out how to do certain gynecological surgeries, etc., so that he could turn around and make a profit then performing these same surgeries on white women. So there's that, and that legacy lives on. I can quote numerous different ways and places that healthcare has grown by experimenting on Black bodies. So that is a problem. That legacy kind of carries over into the modern day, and Black women are, even with the abysmal rates that white women have, Black women have 3 times the amount of maternal deaths that white and other women of other colors do. So yeah, that is a huge problem. I have seen that racism firsthand myself with some of my doula clients. I've heard nurses and doctors say things that just shocked me. I could not believe what I was hearing. So I've been witness to that. It's not always as covert as some people think it is. It's definitely built into our system. So that is something we definitely need to address. Another thing is, since the pandemic, and even before that, people have been interested in looking at alternatives to birthing in hospitals, because a lot of people have been dissatisfied with how they've been treated, how they have not been listened to, which is a big part of the maternal healthcare crisis. The sterileness of hospitals, the way they feel like they are just a number in the system. They're not getting quality care, they're not getting individualized care. All of these things are major problems. So how do we go about addressing these things? Well, according to the WHO, the World Health Organization, the thing we need the most in the world right now to help address these problems is more midwives, specifically 1 million more midwives. So because the midwifery model of care is more about individualized care, listening to women, making time for their questions, making at least 30 minutes for each appointment. All of these things create an environment where women are ultimately listened to, heard, their symptoms are more adequately explored, and midwives are trained to be more proactive in keeping people healthy before problems become major problems, which is easier to do, again, if you have a smaller client load and you are listening to your women and spending like 30 or more minutes with them each time. You are going to pick up on problems that maybe other people have not seen. I know I myself feel like my life was saved because I hired a midwife. I was doing co-care with a midwife and a doctor, and my midwife caught some serious problems that my doctor had not seen, and I'm grateful. So that is why I'm studying midwifery, and I just wanted to share that with you. That's my informative speech. Thank you.